For my persuasive speech, I have chosen why someone should donate to a foundation like the Kawasaki Disease Foundation. For my audience, I have my mom and my stepdad Wayne. Although my camera is not working because it has a huge crack down the middle, I have to do it this way without video. I have chosen this topic because my neighbor's baby had Kawasaki disease about 4 to 5 years ago, and he's no longer with us because of Kawasaki disease and the lack of research that was within Kawasaki disease at the time. Let me tell you about Kawasaki disease. Kawasaki disease is an illness that involves the skin, the mouth, and lymph nodes. And most often, this disease affects kids under the age of 5. The cause of this disease is unknown, but if the symptoms are recognized early, kids with Kawasaki disease can fully recover within a few days. Untreated, it can lead to serious complications that can affect the heart. In Kawasaki disease, there are 2 phases. Kawasaki disease can't be prevented, but usually has telltale symptoms and signs that appear in phases. The first phase of the 2 phases can last up to 2 weeks, and it usually involves a fever that lasts for at least 5 days or more. Other symptoms include severe redness in eyes, a rash on the stomach, chest, and genitals, red, dry, cracked lips, swollen tongue with white coating and big red bumps, which is often called strawberry tongue, sore, irritated throat, swollen palms on the hands and soles of the feet with a purple-red color, and swollen lymph nodes. All these symptoms are in a lot of other diseases and sicknesses, which is hard for doctors to always pinpoint if it is Kawasaki disease because all these symptoms are in other diseases. But you never want to rule out Kawasaki disease because it could always be a choice. However, Kawasaki disease is not always on the doctor's mind when they're trying to say what is wrong with the kid or what is sick with him. That's why you can never rule it out because it could always be an option and can lead to dangerous endings. During the second phase of Kawasaki disease, which usually begins with 2 weeks of whenever the fever started, the skin on the hands and feet may begin to peel in large pieces. This can even happen if children who have already been treated. Also, a child may have joint pain, diarrhea, and vomiting, or abdominal pain. That's phase 2 of the disease. If Kawasaki disease is untreated, cases can lead to more serious complications such as vasculitis and inflammation of the blood vessels. This can be particularly dangerous because it can affect coronary arteries, which supply blood to the heart, which is why my neighbor's baby died, because they had no idea it was Kawasaki disease at the time, and when they did, it was too late. It pretty much affects the heart when it's untreated, which leads to death in most child cases. Besides the coronary arteries, the heart muscle, lining valves, and other outer membrane around the heart can become inflamed. This changes in the normal pattern of the heartbeat, causing blood flow problems in the child's heart. This disease needs more research so doctors can tell right away if it's Kawasaki disease and they can get treatment. And also, people should donate to this foundation, so one day hopefully they can find a cure for Kawasaki disease and save more children's life. Thank you for listening to my speech, and I hope you enjoyed it.